अच्छा, इसको हम स्टार्ट करते हैं। औज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। कुल हुवल्लाहु अहद, अल्लाहुस समद, लम यलिद वलम यूलद वलम यकुल लहू कुफुवन अहद। अल्लाहुम्मा सल्लि अला मुहम्मदिन व आलि मुहम्मद। Today's topic is very important. Pakistan flood health care disaster management. 2022 में पाकिस्तान में एक बहुत बड़ा डिसास्टर आया और उसने ऑलमोस्ट इन्वॉल्व all the provinces of the Pakistan. We have invited Dr. Mehdi Raza. He is expert. He is specialist in disaster management, not only the flood, especially the earthquakes and others. And mass disaster management is his specialization. Thank you very much, Dr. Mehdi Raza. It is over to you because we should start because time, I think it is a midnight in the USA, and you are giving us the time. Thank you so much, sir. Over to you, Dr. Mehdi Raza.
Bismillahirrahmanirrahim. Assalamu alaikum. Just want to make sure that you can all hear my voice and see the screen. Yes, thumbs up for both of those. You can hear
It's
my
fine.
voice?
Fine.
Okay, perfect. Take it. Okay, great. So, Dr. Mulazim, you have requested that I throw in Urdu here and there. I'll try my best to also translate some aspects of this in Urdu. I just got informed that. So, to the audience, I was just saying to bear with me. It's just that I'm more used to giving this lecture in English. So I want to make sure that the quality of the lecture is not in
Dr.
any way
Mehdi, it is okay.
that.
No issues.
Yeah,
It is
so
okay.
I'll
Fine.
try and I'll try throw in Urdu every place here and there. All right, so let's begin first of all with a little bit of introductions over here. The question is, what is disaster management? I think that's an important question to ask. कि ये है क्या चीज? ये जब आप कभी भी ये अगर देखा आपने ये न्यूज़ पे या अगर यूएन की यूनाइटेड नेशंस की कॉन्फ्रेंसेस पे गए या किसी भी काफ़ी फैसिलिटीज पे हॉस्पिटल्स में खान में I know that there's a robust program actually. We were involved with that, and many other places now have a disaster management program. ये है क्या? So let me just give you a quick introduction on what it is, the science of disaster management. You could say that the science of disaster management, I mean, the idea of disaster management started since caveman times. जब आग थी, कुछ इंसिडेंट्स होते थे, कोई खतरनाक चीज होती थी, चले उसी को डिजास्टर लोग कहते थे. लेकिन ये साइंस जब बनी है, when the actual science came, it was really started to take off in 1970s in the US. And because of the funding of research, it really took off when in 1970s the US faced floods, rather actually forest fires. But the reason that this is applicable to floods is because then we figured out from then how to respond during disasters. So what are disasters? Disasters means that it's any event that overwhelms a system, where the ability to respond and coordinate for a system is overwhelming and the current resources are not enough. So that's what that's what defines a disaster. So this is a science that allows us to be able to manage and respond to an event that is overwhelming for the current existing systems. A little bit introduction about myself. I've worked at Johns Hopkins Health System, University of Maryland Medical Center. University of Maryland Medical Center includes the shock trauma. That's where the science of trauma medicine was initiated. I was the inaugural director of disaster management department over there. I have been working with IMI in parallel in Imamiya Medics International for as long as I can remember. And today I come to you on that platform. So this institution, really the purpose of this institution is to serve all of humanity. We don't discriminate, whether, you're Muslim, non-Muslim, it doesn't matter. We are globally in almost every corner of the world, and we serve people from all backgrounds. So we have been involved with a lot of developing nations and efforts in improving and doing our best to help complement the existing structures there. So like I said, that's my background. I don't want to spend too much of the time of my background. You can probably just Google me and find out more. But let's go right into it on the question of why. Whenever we do these lectures, I think the key thing here is to ask ourselves why. And that should be really the motivating factor. You need to really be honest with yourself of why you're doing what you're doing. Why is it that today you're taking time out at 11 a.m. in Pakistan, sitting here and listening to this? The reason I'm telling you that is because if your why is strong, then everything else that follows will be easier. But if your why is compromised, it is weak, then nothing I'm saying today will really matter. All right, so just think about that, and we're gonna end our conversation with this question again. So for now, I just want you to, at the back of your mind, ask yourself very honestly, why are you sitting here today doing what you're doing? So some background of the context of what we are about to talk. Floods in Pakistan is a relatively common occurrence. Since decades now, there have been major floods. 2020, of course, was the last big one, but I think, even from the perspective of Pakistan, let's not forget the flood in 2010. 2010, actually, that, the amount of mortality, and it was around, I believe, $9 billion economic loss that occurred to Pakistan was absolutely massive. And before that, it was in 92, 73, and I think there was even a flood in 1950. So the point is that this region is prone, and unfortunately, it's only getting worse. And the reason it's getting worse is because the data that we are looking at, especially as it relates to Pakistan, it's the monsoon rains are getting more frequent and more intense. And also the rivers, the levels are getting very unpredictable, and it's only going to get worse because of climate change. Why? Because of the Himalayan glaciers, they're melting, and when they flow downstream into Pakistan, that contributes to a catastrophic disaster. So all this means is that, unfortunately, the impacts of flood are something that we will have to contend with as an ongoing issue, and we cannot ignore it. So we have to really lean in and make sure that we are prepared. Most of the time people have slides and they have a lot of words, and I usually like to do it the other way around. That's my style. So I'm gonna use few words, and I'm gonna hope that the audience is following along. Few words as in few words on the slides, but I'm going to be talking about it and I'll be explaining it more because I want your focus to be on me rather to be on the words on the slides. So before we embark on this journey of disaster management, the first thing we have to ask ourselves is, how important is this disaster management of floods compared to other disasters? The reason is because if you want to convince your institution, let's say you work in a hospital, so if you want to convince your hospital leadership that more funding, more efforts need to go into preparedness for floods? Well, you need to make a case, right? You need to convince them that this disaster, this risk from flooding is more than other disasters that could occur. It's more than earthquakes, let's say. It's more than security threats or what have you. Similarly, and I understand that there are a few folks here that are not just from the healthcare sector, but also from the non-healthcare sector, from the public sector. Well, similarly, in the public realm, if you're going to be convincing your leadership, whether it's at the city or the provincial leadership, that more funding and more efforts need to go into flood, well, again, you need to be able to make your case of how the risks of floods compares with the risks of any other disasters. So the conversation really begins with this ability to conduct an effective hazard vulnerability analysis. So what is a hazard vulnerability analysis? Well, the hazard vulnerability analysis is really an objective way of looking at all the various risks that could occur and then grading them in an objective way. So how do you do it? Well, it's in a hospital setting, for example. You invite all the key stakeholders to your meeting. You form a committee. You create a robust meeting, and in that committee, you include all the key stakeholders that you can think of. You, of course, include the medical leadership, and you include the other staff. I'm sorry, I'm seeing a question coming up. We'll answer questions towards the end, inshallah. All right, so you include all the leadership that comes in. You include the security leadership. You include the janitorial leadership. You include everybody, facilities, the structures, the building maintenance, everybody into that committee. You bring them together and you ask them, what are essentially the disasters or hazards, in this case, that you are concerned about, that you are, that you feel uncomfortable about, that, you cannot sleep at night. And this is just an example of how it's done. So there are many different categories. I'm just showing you a little snip of this that some hospitals could use. So look at all these hazards over here. We have air quality issues, dam failure, drought, earthquake, fire, flood, hurricane. Inclement weather basically means, that's like snowstorms, landslides, and so on and so forth, tsunami. So you include not just natural disasters, you can include, everything in there. The security threats, bomb threats, if there's a child abduction, act terrorism, active shooter. And again, this is just a small list I'm just showing you. It's, you can make this as long as you would like. And then once you brought everybody together and asked them to contribute to making this list, then you ask everybody, if there's some data to be able to prove your point, that's great. If there's some historical data to show, or there's some prediction models to show, what's the probability of this region getting a flood, or what's the probability based on what we're seeing of this region getting a drought, or, is this a dangerous area as far as the security risks are concerned? Is there a vulnerability to that? What's interesting is that I live in Baltimore City in Maryland. It has unfortunately one of the highest murder rates per capita in the US. So it's arguably one of the most dangerous cities in the US when we look at it by rate. So that is something we have to consider. It is, by the way, I don't want to disparage Baltimore. It is an absolutely beautiful place. It is great to be in. But we also don't want to stick our heads in the sand and ignore the reality that exists. And I'm sure you can appreciate this living in Pakistan, because some areas obviously suffer from security threats more so than other places there as well. So you can look at this. So you look at all these hazards, get that group together, ask them to contribute, look at the probability. Once you look at the probability, then ask the team, okay, how much of an impact, if this hazard were to occur today, not in the future once we are better prepared. No. If this hazard were to occur today, right now, what is the impact that this hazard is going to have on property, on human, on business? So human impact, obviously injury or death. The property impact, it basically refers to the fact of how much damage can it cause to the building structures. And business impact means whatever the purpose of that hospital is, will it be able to perform its core functions? And if those core functions are impacted, how severe would that impact be? For example, if your hospital's core function, if you say, no matter what, we have to be able to, cater to, emergency situations like a patient coming in with a case of an MI. If you say, if we cannot even treat an MI, then फिर कोई फायदा ही नहीं है इस अस्पताल की existence का. Then we might as well just close it down. Or or if you said this hospital absolutely, no matter what, needs to be able to help a mother deliver a baby. If again, you can say, अगर ये अस्पताल वही नहीं कर सकता है, यही नहीं कर सकता, तो फायदा ही नहीं है. So you can look at whatever the core functions of the hospital are, or as an institution, the city or the government, the provincial government, whatever the core functions are at an institution or a city level. It could be your transportation, right? It could be being able to deliver utilities like electricity, clean water and whatnot to your residents. If it cannot do that, well, that's your core functions that have been impacted. So the question is, what is the impact of that business? So you look at the probability, you look at all this impact, then you look at, well, if this was to happen, we looked at the impact. In fact, it's sort of like the negative, if you will. What is the bad that can happen? Then on the other side, what is the good that we have in place? What are the existing structures that we have in place? For example, is there something special about this building or about this city that makes it so that we are better prepared for a hazard? Whether it's a security hazard, whether it's a natural disaster hazard like flooding. And you take into account your preparedness, you take into account your ability to respond internally and externally. You take all this together, and then you give a score. And that score, is going to be your objective score. And then you compare it with all the other hazards. Based on the questions that you may have later on, we can go more into how we are able to calculate this. But my purpose today is not to make you all PhDs in disaster management in simply 1 hour or less than 1 hour lecture. Is to be able to change your perspective on things, just to give you a few ideas that you can take back to your institutions and start, doing things. One thing I will say is that the elegance of an idea or of an elegance of a strategy is in its simplicity. Something you may not have thought of before, but once you think of it or once it's introduced to you, you realize that not only does it make sense, but it can easily be done. So, oftentimes, whenever I go anywhere in the world, and even in the US, does not matter, one of the first things everybody says, whether it's even Johns Hopkins, whether it's University of Maryland Medical Center, whether it's Pakistan, whether it's Iraq, everywhere I go, what's the main, or Nigeria, what's one of the main things people say to me? They say, we are so different, Dr. Mehdi, what you're telling us, we are so different than anywhere else you have been. What you're saying to us can never work here. Well, I tell them the beauty of disaster management, the science of disaster management, is that it does not matter where you are. It's like breathing, right? It does not matter where you are in the world. It should be able to be functional, regardless of your resources, regardless of how much money you have, regardless of developed your institutions or your places are. So, I hope you agree that being able to do a hazard vulnerability analysis hopefully does not take a lot of money, does not take a lot of technology, does not require you to be super developed. It just requires you to be able to collaborate with your peers. So this should be the foundation of any disaster preparedness you do. The reason I'm saying that you do this is because once you do this hazard vulnerability analysis and then you realize that the objective score of flood is one of the top 5 disasters or hazards or risks that you are going to be facing, then that makes it easier for you to convince your peers, your colleagues, as well as your leadership that we need to prioritize flood disaster related efforts, exercises, mitigation efforts, and structural resilience, and so on, so forth. Otherwise, there are 100 things people want to work on. If you think flood is a priority for you, well, it may not be a priority for your peer, it may not be a priority for your leadership, and this is an objective way of prioritizing that. So hopefully that is something that you can take back. And again, like I said, the questions, I know they're coming in, and inshallah, we're going to answer them towards the end. Now, same committee, perhaps a few more people, you should create what is called an emergency operation plan. What emergency operation plan means is you create a comprehensive plan of what will be done in case of a disaster. So let's say the emergency operation plan includes planning for an act of terrorism. It could also include planning for earthquake. It could also include planning for flooding. So what that means is emergency operation plan outlines what you're going to do, not necessarily to prepare for it, but what will you do if that was to occur today? So you get together with that same group, with all the experts from various different subject matter areas. You bring them all together, and in a collaborative fashion, you create a plan. And it doesn't have to be perfect, but you create it. You try your best to create a plan, and that plan will include all aspects of a disaster response. So that should include something like, all right, well, if a flood was to occur right now in a hospital, let's say, how will we evacuate the patients? Do we have existing partnerships with other hospitals? If there's a hospital 2-3 miles, or let's say that's too short, but let's just for the sake of the example, if there's a hospital like 20 miles down the road, do we have a good relationship with them? Yeah, I know institutions compete and it's a healthy competition, but do we have an ongoing relationship with them? Does our leadership communicate with their leadership? Do our peers communicate with their peers? Do we have a healthy collaborative relationship? Have we talked to each other? What will happen if my facility gets flooded? How will we transport patients to your facility and vice versa? How many patients can you take? What is the capability of your of your nurses and what your doctors, your staff, can they handle a patient that has X level of an acute criteria, and so on and so forth, or specialized care? And so you collaborate not just with other hospitals, but also with existing NGOs and also governmental organizations. You form a collaborative group. You know, has anybody reached out to the governmental, services that are available, NGOs that are available? You know, even if it's the military, I know in a lot of these places, the military plays a big role. Has anybody, has formed a pre-existing plan with them on what will happen, during these situations? I know, again, in countries like Pakistan, the military plays the same role as the National Guard does in the U.S. Our military in the U.S., for example, cannot intervene in domestic affairs. They're entirely for the border defense. But within the contiguous U.S., we have what is known as the National Guard that can come to help us, and they have been, very helpful in these situations. So, what existing plans exist? Have you collaborative relationships? Not just, हाँ जी वो बात की थी कभी, चाय के ऊपर, आज से, 2-3 साल पहले. No, like, is something written down? Is there something, tangible? क्या कोई ठोस plan बना है? And is that plan updated? Do we have, memorandum of agreements with them? So all this needs to be worked out beforehand. Again, like I said, it doesn't have to be perfect. And now the question is, in that emergency operations plan, not only do you have all those, response and memorandum of agreements, but you also have all the partnerships. Also, partnerships with various organizations, whether they're your vendors. In such a case of a disaster, are you going to be able to get the medicines you need? Does the pharmaceutical company or the manufacturer or the transporter, do they have the ability to transport key drugs to your facility in case of a disaster? If not, then what's your plan? Now, disaster management. So that's your emergency operations plan. So, just recapping a bit, because I know we're covering a lot and I want to make sure that I'm not losing you. And I'm trying not to go too much in depth. I want to give you a taste, a broad horizontal taste of, of key points without going too much in depth to be able to give you an idea what to do. So going back, we got hazard vulnerability analysis. That's the first thing. You form a committee, you list down objectively which of these hazards you think you should prioritize. Hopefully in the top 5 will be your floods. So now you can start creating efforts towards preparing for that. You, again, form a group together, you start creating that emergency operations plan. That means key collaborators, A to Z, something written down. Doesn't have to be perfect, and I'll tell you why in just a second, why it doesn't have to be perfect. Now you look at what mitigation efforts you have. Mitigation means, what is something that's already in place to prevent it? So, for example, mitigation efforts for flooding at a city level could be, flood channels, could be irrigation systems, could be dams, could be, various infrastructural, elevations that help, mitigate or lessen the impact of flooding. So similarly, within a hospital, what mitigation efforts do we have that can help us when it comes to flooding? Do we have the ability, to be able to drain water at a rapid speed? Do we have the ability to be able to, keep making sure that all our electronic equipment, is at a certain height? What about our backup generators? Are they in a place that are going to be, safe and from the impacts of flooding of course, up until a certain level? And so, what are some structural, aspects that exist to help lessen the impact of flooding if it does happen? That's what mitigation refers to. Then there's your preparedness. Preparedness means, part of preparedness is creating, like I said, emergency operations plan. Now there's the other part of preparedness, and that is training and exercise. Remember I said that emergency operations plan don't have to be perfect. Why did I say that? Because as much as you think you can get things perfectly right by theory, That's a delusion. You can never get things completely right just by doing something in theory. So that emergency operations plan, yes, work on it, but don't spend too much time on it. Meaning, try your best, create a draft, because then test it. And that's where you're going to get the real information. What do I mean by test it? Meaning, run an exercise, create a scenario. When we were in Pakistan, we did a mass casualty incident drill in Karachi. This was, I believe it was around 2018, 2019. And there were many hospitals that were involved. It was and it was on behalf of the Johns Hopkins Hospital and several hospitals, in the area, in Karachi. And so the question is, getting a group together, getting your staff, your medical students would love to be, pretend to be actors, pretending to be patients. So, getting them to play the role of, patients and actors, so running through an exercise, getting all the staff and everybody together. Now you may be wondering, well, what value is an exercise if everybody knows is about to happen? There's still great value in it, because there are things you may uncover that you thought were very easy that you'll realize through that exercise that they're not easy. So running through the exercise, using the emergency operations plan as a guide, because remember, you created an emergency operations plan to see how I would respond. Well, okay, let's see if this response that I created, if it makes sense when I'm looking at the exercise. Once you do the exercise, you realize, wow, there are a lot of improvements I need to make. So you evaluate your exercise, and then you come back to the emergency operations plan, and then you edit it, and then you update it. That's how you create a strong emergency operations plan. And it's a continuous cycle, meaning it's not that, ठीक है जी, बना लिया, अब जो है ना उसको बुक को बंद रख करके अब उसको side mein rakhte hain. No, it has to be constantly updated. It has to be reviewed. You need to do exercises consistently throughout the year. The committee needs to come together, evaluate the exercise, and update the emergency operations plans. That's how you create something that is robust. A couple of things I will mention in your immediate response plans. Don't forget about triage areas, meaning if there's a flood outside and if your facility is not impacted by the flood, but if areas close to you are impacted by the flood and there are already injuries, then remember, if you're one of the few hospitals that are not impacted by the flood, that means you're going to get a surge of patients coming in. So the question is, do you have plans in place when you get a sudden volume influx of patients coming in? Do you have areas to do triage, for a massive volume of patients? Do you have the ability to communicate with your staff internally? What platforms do you use to be able to send out mass information, to be able to communicate with your staff? Do you have the ability to communicate with other hospitals? Do you have the ability to communicate with other NGOs and the governmental agencies? Communication is one of the key aspects that people forget during disasters. Do you have a plan of social media? अब तो सबके पास सेल फोन होता है और सबके पास जो है वो सोशल मीडिया भी होता है, Twitter, Instagram, Facebook, what have you. So the question is, do you have plans in place? Do you have someone or a team monitoring the social media feeds? So not only are you getting information from social media, but also you are making the public aware and updating them for their safety. Because remember, if the public is not safe, they get hurt. If they get hurt, they come to you in the hospital and use the resources. So you're making sure that the information flow is controlled. So this is all part of preparedness. And then if a disaster actually occurs and you have to respond, when you come back, when the dust is settled, when things have gotten better, when you come back, the question is there an evaluation that's done? ये नहीं कि ठीक है जी सलाब हो गया आ गया चला गया, अब जो we're back to our jobs, and we're all like, thanking Allah, shukr hai ji wo ho gaya, alhamdulillah, we're safe, chale bismillah, let's just continue life as is. No. Take a pause. Have you gotten everybody together? The same committee we're talking about who's been engaged this whole time, getting them together and asking them, okay, let's evaluate our response. Don't blame anybody. The key here is the problem is in healthcare, especially, and this is unfortunately a trend I know in other businesses too, but especially in healthcare, the first thing that starts happening is, ये आपकी fault थी नहीं, ये आपकी fault थी, ये आपने गलती की. No, relax, we are a team. Don't blame anybody. Just come together and look at process, not person, process. It should be focused on not the fault of people or persons. It should be focused, the focus of the discussion should be on the fault of the process. What can we do for the process to improve it? And that's how you create better processes, and that's how you evaluate your response of an actual event. And last but not least, I would say there's one more aspect to it, and that's recovery. But before I go to recovery, just remember, when you're coordinating with all the staff, with all the different agencies, you have to be able to have command and control of all the moving parts. Otherwise, there's chaos. The flood has already created chaos. But if you don't have command and control of your own staff, then that's going to compound on the chaos. It's chaos upon chaos. So the question is, how do you create the command and control? Well, there's a whole other lecture I do, and that's called how to use this structure called incident command system structure. It's one of the best ways to be able to command and control the staff. But we're not going to go too deep into that. All I'm going to mention today is in your emergency operations plan, in your preparedness plan, do you have a structure written out of who's going to take charge? Okay, let's say the hospital, I don't know what the hierarchy there is in Pakistan, but in the US, it's the hospital CEO, or the hospital CO, chief operations officer, or someone like me who's the director of disaster management, in a case of a disaster. I will take control of the entire response. Right. So now the question is, okay, well, if that person's not there, who's their backup? Who's the backup to the backup? So at least you have 3-4 layers of backup. So for each role, so who's going to take control, and then do they have the team in place? What are the important functions, and do they have the team in place to be able to do those functions? And again, each of those functions should have 4 backups, at least 3, not 4. And then, of course, there's the recovery. So remember, you started with mitigation. Mitigation means things that are in place to lessen the impact of a disaster. There is preparedness, creating the plans, doing the exercises, evaluating it. There's a response, meaning now you respond because the hazard or disaster is actually happening, like flood. But then you also make sure that you evaluate your response to be able to make your plan for next time better. Now there's recovery. Remember, just because a flood is done, you've responded. Don't forget that the battle is not over yet, unfortunately, because now they are secondary, tertiary causes, negative causes of a disaster like flood. They are, for example, waterborne illnesses. Now you're going to get patients coming in with infectious diseases. Now you're going to get patients coming in who already had chronic diseases like diabetes and heart disease that have now become, unfortunately, exacerbated and worse because they were not able to get access to healthcare. Their mental health issues. This is a big one. It's a big stigma, unfortunately, everywhere, but this is one of the biggest aspects that are missed. There's PTSD, and remember, these are not small things. These are not, just because, it's not obvious when someone is injured in their mind, like, if they have a traumatic wound, that's more obvious. If they have a huge gash, with an uncontrollable bleeding, that's more obvious. But, PTSD, can lead to a lot of other harm. You know, the way, you know, if you know, if a husband has PTSD, you know, the way he's gonna react towards his wife, or a father, you know, the way he's gonna react towards his children, you know, the way he's may not be capable to be able to earn a living. So that's going to cause a very real impact on the lives and endanger perhaps even the safety, you know, the physical and the health and the safety of his family. So these are, you know, recovery aspects. There's an economic component to it, the funding and so on and so forth. Do we have relationships already in place from maybe external partners, you know, whether it's, you know, national, international, global partners in place, so that in the situations like this, we don't have to, you know, go around begging for funding to be able to recover, and that is able to, that stream is able to flow in. You know, sometimes you'll be surprised. Help is there, but during a disaster, there's so much confusion and chaos. Even right after a disaster, there's so much stress, confusion, chaos, that getting the help that is there may not be easily available. But if you just do a little bit of effort beforehand on planning, then God forbid something like this were to happen, you can access that help in a timely manner. Remember, I told you that you need to ask yourself why you're doing what you're doing. And that is the key, because if your why is strong, I'm telling you, then everything else that follows is going to be easy. You're not going to have any excuses. Again, like I said, even all the world's best institutions that I've had the privilege of visiting, and places that are severely infrastructurally challenged, the irony is that every place says, well, we are very different. We cannot do what you're doing. You know, this only works in that place. No, everything I've told you doesn't require a lot of money. It doesn't require a lot of technology. All it requires is willingness. So the question is do you have the willingness to be able to do what we're talking about today? It's simple, right? It's simple. So the question is, what is your why? Because if your why is just focused on what, it's not going to be good, because you're going to always come up with excuses. I don't have enough resources. You know, we are very unique. We're nowhere else in the world is like us. You know, no. वाकई भाई हम कह रहे हैं कि हमारी जो कि सिचुएशन है ना, ये आपको कहीं नहीं मिलेगी दुनिया में. I have heard the same thing from everywhere I go to. Believe me. So make sure your why is strong, because if that's not strong, then you're going to have a lot of excuses, and that's going to lead to a lack of success. So don't be focused on what can go wrong and what can go wrong. Well, the reason we can't do it is because of this. Have the why that is strong. I'm telling you, have the why that is strong. If that's strong, your ability, your efforts, your outcome is going to be strong too. What is the why of IMI? It's this. It's simply translated as, if you save the life of one, it is as if you have saved all of humanity. So just remember, you're not there trying to make the whole world perfect. Your plans and everything are there just to make sure you're able to save, perhaps, inshallah, one life. And then you would be successful. Thank you.
Thank you so much, Dr. Mehdi, Rizvi. Thank you so much. Very nice presentation, and all the presentation was exactly nice, and you tried best. Even at some areas you translated in Urdu. No doubt, we all are doctors sitting here, and we will upload this videos to our websites, and the peoples, and they will consult with us. And now it is open for the questions. If anybody want to ask the question, they raise the hand. The first question is Dr. Iqbal Dogar Saab. Dr. Iqbal Dogar Saab is the principal of Gujranwala Medical College. Ji, Dr. Iqbal Dogar Saab, welcome, sir. Did you open you are on mute, sir? Unmute.
जी
Yes.
जी, अब मेरी आवाज आ रही सर?
जी, Dogar
मेरी
Saab.
आवाज आ रही सर?
आ रही है.
Assalamu alaikum. Good afternoon, everybody. Thank you very much, Professor Murazam Bukhari, for arranging such a wonderful, needed topic. And I'm really appreciate Dr. Rizvi. Dr. Rizvi, I have one question. Yesterday, I was the member of a committee in which Chief Minister Punjab make a committee. There was a revamping going on in our hospitals in whole Punjab, and there was one incident happened, that is one roof collapsed, and one patient was admitted in that area, that unfortunately died, and multiple patients suffered from multiple injuries. So you described that we should focus on the processes, not on the individuals. Can you explain more that how we can improve these processes, and what we should suggest in that inquiry, that how we should proceed like processes, please?
Ji,
Excellent
Assalamu
question,
alaikum.
Dr. Bogar.
Ji, Assalamu alaikum, and thank you. That was a great question. Let me say this. If we compare the healthcare industry compared to some of the other industries, by the way, हम लोग हमेशा कहते हैं कि भाई healthcare जो है ना, ये बड़ी यूनिक इंडस्ट्री है, बिकॉज ये इतनी कॉम्प्लेक्स इंडस्ट्री है और इसमें इतने वेरिएबल्स होते हैं, और लाइफ और डेथ का यहाँ पे तो सिलसिला है, तो इट्स वेरी अनलाइक एनी अदर इंडस्ट्री. I hate to tell you all, actually that's not very unique. It's just that we are in a little bubble. We don't realize there are many other industries that actually, believe it or not, are just as complex and are just as risk. So for example, there's the nuclear industry. There's a nuclear power plant. It's a highly complex process, and if they mess up, lives will be lost. Similarly, the airline industry, if it's a very complex process with a lot of variables, if they mess up, lives will be lost. And imagine if the planes were dropping, a few Boeing planes have gone down, और पूरी दुनिया जो है ना वो मीडिया पे आ गया है. Imagine if the healthcare errors, the rate of healthcare errors, the same number of rate Boeing's planes were falling down. All the flights would be halted today. Nobody would fly. The reason I'm saying all this is the reason that these industries are so successful, airline and nuclear industry, is because whenever something bad happens, the first thing they do is not blame ke, bhai, aapki galti thi. Nahi, what they do is they say ke, how did this happen? Meaning, so now I'll explain to you, coming back to your question specifically, meaning, okay, are we up to code? The international standards, the building code, are we following that when it comes to this? ये नहीं कि भाई ये building किसने बनाई थी? नहीं. Do we have a process in place? How often do we update it and review it? Do we have the funding for it? कहते हैं unfortunately, अक्सर ये होता है कि हमारे मुल्क में भाई, I can say, पाकिस्तान so I can say, ये भी हमारा मुल्क है, ठीक है, यहाँ बैठा हुआ, लेकिन हमारे मुल्क में ये होता है कि कोई जो कि बेचारा होता है ना, गरीब होता है, बेचारा होता है, हमेशा उसी को कहते हैं, लोग कहते हैं फंसाते हैं. जो कि पावरफुल बंदा होता है वो तो उसकी तो माफी होती है. So in the building collapse, बेचारों के मजदूर होगा, हाँ तुमने गलत किया है. No, it's not the person. The question is, do we have a review, updated review of the codes? If I'm doing a surgery in this room, it's not that the responsibility of just that, the facilities person. I need to make sure my patient is safe. So even though I'm a surgeon, I'm not a building and an architect person, but shouldn't I also have the responsibility to make sure that I can review, how often is this room, the building, the structure is being updated? What is the process? What is the funding? कब कहीं पे plan लिखा हुआ है, कहीं पे policy है. अगर policy है तो उसको क्या system है make sure करने का कि policy वो follow करी जा रही है. Airline industry, for example, उन लोगों की पॉलिसी है कि सारे मतलब इंजन और पुर्जे जहाज के फ्लाइट से पहले जो है ना वो काम कर रहे हैं. They have a checklist. अच्छा भाई ये सही काम कर रहा है, ये सही काम कर रहा है, ये सही काम कर रहा है. So is there a checklist do we have in place? Now, the group may say, "अरे भाई, checklist से क्या होता है? वो तो simple सी चीज है." So, Dr. Iqbal, I think it just give you a great idea there. So, number one, policy. Number two, checklist. Do they exist? Now, let me talk about checklist. Look at them, checklist se kya gaya? Remember, not too long ago, the most dangerous part of a surgery wasn't the surgery. It was what? Anesthesia. Now, the safest part of a surgery is anesthesia, isn't it? What happened? What changed? Yes, there's medical innovations and advancements, but you know what one of the key factors was? They looked at the airline industry and they started to incorporate checklists before doing surgeries. Until this day, because they took from the airline industry and they started to incorporate checklists for their surgeries. Until this day, because they use checklists, anesthesia is the most safest part of surgery. So, Dr. Iqbal, I hope that helps you. Look at your policy and look at systems in place that make sure that policy is monitored and see if a checklist exists. That should be a starting point. So that's what I mean by process, not a person, process. Hopefully that helps.
Thank you so much. Thank you so much. A very nice question. We all face such questions in our administration and especially in the public sectors. Okay, Dr. Professor Zamirul Hasan Naqvi Sahab. Professor Zamirul Hasan Naqvi is not doctor, but he is academicians. Dr. Zamirul Hasan Naqvi Sahab. Yes, Dr.
Assalamu
Nazir.
alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullahi wa barakatuh.
I'm highly appreciate to Professor Dr. Mulazim San Bukhari and all the member of this team. They gave us such big opportunity to listen this lecture webinar, attend the webinar. मैं मेडिकल फील्ड से नहीं हूँ, मैं यूनिवर्सिटी से हूँ. मेरे क्वेश्चन है टू ऑल द रेस्पेक्टेड और फाजिल मेंबरान से कि 47 से लेके आज तक पाकिस्तान के अंदर तालीम और मेडिकल दो इंडस्ट्रीज हैं जिन्होंने बहुत ग्रो किया है. जितने इलेक्ट्रॉनिक चैनल हैं, जितने हीरोइन बेचने वाले हैं, दे कम टू नो कि ये दो इंडस्ट्रीज हैं कि जिनके ऊपर खर्चा बहुत कम है, ये फैसिलिटी बिल्कुल नहीं देते और ये 2 से 2.5 साल में अपना जितना इनका खर्चा होता है वो ब्रेक इवन पे आ जाते हैं. गवर्नमेंट सर्विस से, पब्लिक सेक्टर से रिटायर होने के बाद डॉक्टर मुलाजिम बुखारी साहब मुझे जानते हैं कि मैं 2 यूनिवर्सिटियां स्टैब्लिश कर चुका हूं एंड यूनिवर्सिटी कैन कम ऑन ब्रेक इवन 2.5 अरब 2 अरब का ब्रेक इवन जो है वो 2.5 साल में कर लेता है. क्या पाकिस्तान में मेडिकल फील्ड और एजुकेशन फील्ड में लोगों को क्वालिटी भी मिलेगी या लूटा जाता रहेगा? मैं खुद एजुकेशन फील्ड से हूं, आप मेडिकल से हैं. मैं माजरत के साथ दुखी दिल से एट द एज ऑफ 72 ईयर्स ये बात कर रहा हूं. थैंक यू. ओवर टू यू.
Thank you, Professor Zamir. Different question, entirely different question. Okay, Dr. Rizvi Saab.
Ji. Thank you, Dr. Zamir. That's, a good point. And inshallah, we can help, in any way we can to be able to enhance educational, efforts in Pakistan with our partners there. Some of the questions that I have over here is, are there any disaster health efforts? I'm looking at the chat, and by the way, if there's anybody else that has a question, please raise your hand in the use the hand icon and inshallah we'll get to you. So there's a question here that are there any organizations managing disasters?
Question, Dr. Salma.
Yeah, sorry. So just give me 1 second while I read this one, and then I'll come back to that. Organization managing health disasters in Gaza, if yes. So that's a good question. So the question is if there's any health disaster efforts in Gaza.
Gaza.
I'll be, I'll be honest, I don't know exactly, but I'm sure they are. The reason I don't know is because IMI is so huge. We have got fingerprints everywhere in the globe. And unfortunately, I'm not everywhere. I would love to be everywhere and do things everywhere. But I'm not. But fortunately, because IMI is so big and it's always been a team effort, we are everywhere. So I will, Dr. Mulazim, maybe even you know that better than I do. And,
Yes, yes,
otherwise I
yes,
will refer to
yes,
IMI
yes.
leadership.
Yes,
Yeah.
yes, Bilkul, this was a question that IMI raised the funding, and we were the first to supply the nutrition and food and medicine. We were the first. We are proud of this, that we supplied in the Gaza through the Egypt, and still we are supplying this. And we have a website. You can see. We will share this website, and on this website we are supplying all these things. Thank you so much, Professor Salma Kundi.
And I just want
Thank
to
you so
clarify
much.
for my purposes, and that was for civilian aid.
Yes, yes.
Okay. Yes.
Professor Salma Kundi.
Thank you so much. Thank you so much, Professor.
Madam, we are not hearing. Professor Salma, we are not hearing because this journey is with you. Webinars, Professor Salma is the chief organizer of this.
Mulazim Sab, I take this opportunity. Rizvi Sab, it was a wonderful. It opened our eyes. I was principal of a youth medical college and then now of women. And strangely, both the buildings of the college are at elevation, but the hostels are a bit lower.
Madam, we are not hearing your voice.
And we get flooding in the hostel and in the youth because of funds they never diverted to other. I hope it's done now. That reminded me this time too, I'm going to make arrangements and at least to vacate the lower floor so that the students do not suffer. Thank you, Dr. Mehdi. It was wonderful. And I thank all the participants who take
Dr.
an hour and a half
Saima,
off on
Dr.
Sunday.
Saima Malik, Madam, Dr. Saima Malik has asked. Dr. Saima Malik, over to you. Saima Chaudhary. Professor Dr. Saima Chaudhary.
Yeah, Dr. Mulazim, I just want to quickly, I just want to quickly be able to respond to Dr. Salma's point. I'm glad you brought that up. That's very, actually that's very wise of you that you're able to think ahead because remember, when disasters happen, they not only impact the staff that are in the hospital, but they could also impact our potential staff where we have to reach to even our medical students for help. And, there is a selfless aspect to it because they're humans, we should care about them. But there's also a selfish aspect to it because we want to keep our medical students safe because guess what? When disasters hit, they will be very, very useful. So their safety is absolutely paramount, not just for our operational continuance, but also just because it's a good thing to do. So I'm glad that you're thinking about that.
Dr.
Thank you,
Saima
Dr.
Chaudhary, you are asking about the national and international agency funding agencies. Dr. Mehdi?
International funding agencies. If you could, Dr. Saab could tell us something about the international funding agencies because currently climate and health is on the top priority of all the organizations. So if you can give us some idea on which funding agencies to explore with our projects, that would be really helpful.
Yeah, absolutely. So, my focus has been on mass casualty incident management, cases of, bomb blasts and so on and so forth, severe traumatic injuries. So I know from that perspective that WHO certainly has a lot of opportunities for collaboration. And as far as research goes, IMI is always here. We would love to collaborate. There is, and I'm sure he wouldn't mind, there is also Dr. Junaid Razak, who is a mentor of mine, who was at Johns Hopkins, full professor of emergency medicine. Now he's at Cornell. He's a vice chair over there at Cornell. He has, I believe he has, quite a robust relationship with Aga Khan and other Pakistan institutions. So, he can also be a great asset. But IMI is always here. We are always looking to partner our individual physicians and subject matter experts, not only for research, but also when the physicians within our group get grant funding, we're always looking for opportunities to be able to use that for international purposes. Just on the top of my head, I would say WHO. Besides the IMI, of course, there's WHO. There is ICRC. There is Dr.
Mehdi, can you share later on the website's contact so that
yeah, sure. Dr. Mulazim, you can reach out to me later on, and we can do some homework and get some specific agencies.
I will forward it to the group and Professor Simon.
Yeah.
I know
So
she is
WHO, ICRC,
in
Red
Pakistan.
Cross. You're right. They're always there, and you can that's what I was thinking of. United Nations risk reduction. So you can look online, look at United Nations risk reduction. In fact, they're very open to collaborations, and IMI actually has a consultancy status with the United Nations risk reduction. That is, we are invited to their meetings. I myself represented IMI, I think it was last year when they had a meeting here in New York. They're always willing to be able to fund those efforts.
Dr. Mehdi, can I ask you something?
Yes,
I
yes.
saw on the Facebook that when things are flooded, I don't know whether it was India or someplace, they put in deep bamboo shoots and it sort of sucks the water into the soil. Has anybody in your team worked on that?
So that's a very good question. What I would say is this. I would even expand that wider. I would say there are several places, several countries that are faced with the same problem, that have much more, are much more advanced than unfortunately Pakistan is currently in terms of the strategies they have implemented. So it's not just India, it's even Japan. It's even Bangladesh has done some fantastic work. So bamboo, roots, that could be one of the strategies. One of the strategies that I know that people have done is, created marshes, the fields, that, are known to absorb a lot of water. But I think, there can be a lot of opportunities for improvement. And ideas that we can look at compared to even the neighboring, South Asian countries that are, actually quite ahead in this. I would say is this. I would say whenever we are trying to, create a positive impact, let's first start to see what influence we can have within our own bubbles, our own circles. And the reason I say that is, let's assume that someone is a physician. It'll probably be easier to influence their hospital. Maybe it may be easier to even influence their floor they work on. So let's start there and let's make sure that our hospital is more resilient. And then, inshallah, we can even work towards advising the government agencies and, pushing them to be able to create structural improvements. So those are great ideas. I just want to make sure that everything we're talking about links back to practicality, so that we are making sure that every effort we are putting in, there's a ROI on it, return of, on our a return on investment of every effort and time that we spend on it. So hopefully that helps and gives some idea.
Great listening to you, Dr. Mehdi.
Thank you so much.
Hope to see you some
Dr.
other
Omar
time.
Khan, Dr. Omar Ali Khan.
Yes, sir. Assalamu alaikum wa rahmatullah, sir.
जी सर.
जी सर, हुक्म सर.
Any your comments, sir?
सर, मैं ये समझता हूँ डॉक्टर हुसैन ने जो एंड किया है ना जी, जो कुरानी आयत पे, if I think this becomes the motto of every person, every human being, ये दुनिया तब्दील हो जाएगी. बाकी सारी बातें हैं, लेकिन जब मैसेज हुसैन ने दिया है, I really love it, and मेरा तो दिल चाहता था डॉक्टर हुसैन का माथा चूमूं जो उन्होंने आखिरी आयत पे कंक्लूड किया, जो समराइज किया है. सो आई थिंक इसके ऊपर हमें थोड़ी एक्सप्लेनेशन डॉक्टर हुसैन और करें कभी ना कभी जरूर. तो आई होप This is the guiding principle. मेरी तो आंखों में आंसू आ गए जब इन्होंने ये आयत पढ़ी. अल्लाह इन्हें बहुत जज़ाए खैर दे और आपको भी, आप सबको. Thank you.
Thank you, Dr. Umar Khan. Alaikum assalam wa rahmatullahi wa barakatuh.
Dr. Umar is the president of Pakistan Physiological
MashaAllah.
Society, is one of the collaborator of today's webinar.
Ji,
And-
mashallah. Ji. Actually, so my name is Dr. Mehdi Rizvi, but my son's name is Hussain. So,
So you are Abu Hussain.
Ji, exactly. Bilkul ji.
I am
bilkul.
also Abu Hussain. My son's name is
Chale.
also Hussain. I am also Abu
Mashallah.
Hussain.
Chale, mashallah. Ji, so, let
Okay,
me,
thank you so much,
ab khair, मैं तो तफसीर में तो नहीं जा सकता हूँ, वो तो मेरी कहते हैं, unfortunately, मेरा तो what do you call वो status ही नहीं है, मैं क्या चीज़ हूँ जो, ये आयत तो क्या चीज़ है, हम क्या चीज़ हैं. But I would just like to say one thing. I would say this, is that the spirit behind that ayat is this. Whenever we try to make improvements, sometimes we get overwhelmed. Especially when we deal with an infrastructure that is so, damaged. हम सोचते हैं यार क्या फायदा है, हम जितनी मेहनत करें क्या फायदा है. बस ये याद रखें, बार बार बस अपने आप को ये रिमाइंड करें कि ठीक है, हम जो है कहते हैं, हम लोग जो है 1000 लोगों को नहीं सेव कर सकते, हम 100 लोगों को भी नहीं सेव कर सकते, लेकिन शायद हम अपने इतनी मेहनत से शायद हम एक बंदे को सेव कर सकते हैं. अगर एक बंदे को सेव कर लेना तो इंशाल्लाह कहते हैं कब्र में भी जा करके थोड़ी सी कुछ रहमत हो जाएगी, हमारे तरफ, अल्लाह दे देगा. बस इस चीज को जो ना याद रखें, और if we can motivate ourselves with that, then I think we can do a lot. Because if one person can save, let's say 2 people, and and those 2 people can end up saving 2 more people, then inshallah, the world will be different, like you said, inshallah.
Jazakallah khair. Thank you.
Dr. Sharma Kundi, over to you to conclude today's session. Professor Sharma.
Okay, I did half of the conclusion a few minutes back. I thank you once again. And finally, I thank you, Dr. Mehdi. It was a pleasure listening to you, and hope you come on this platform some other time and give us some know-how about the bamboo shoots or other things that we can mitigate the floods with. Allah bless you, and Allah bless all the participants and the listeners today. Have a great weekend. Pakistan Zindabad.
Thank you so much. Thank you so much once again, Dr. Rizvi. Thank you so much. Inshallah, we will meet again. We'll upload this videos on our websites, and we'll send these videos to different personals of the government of Pakistan, even at the higher authorities. Thank you so much. Allah Hafiz. Allah Hafiz.